And as we come on the air today, the masks are on, but gloves are off as the Broward School District defies state rules on mandatory masking. And so the mask mandate will be in place when classes start on Wednesday, risking threats of financial sanctions.
The district points to record hospital admissions in Broward, including a rising number of pediatric cases, plus this week the deaths of 3 Broward teachers from COVID. The school board chair and superintendent formally notified the Florida Department of Education in a letter on Friday.
It is a standoff watched around the country with the president on the phone on Friday night. Broward's new superintendent, Dr. Vicki Cartwright, got that president's call of support. And she is with us today along with board chair, Dr. Rosalind Osgood, who drew the line in the sand this week. Great to have you both with us today.
Good morning. Great to see you. Great to meet you, Dr. Cartwright. First of all, tell us about the phone call from the president Friday night. What did he tell you?
Most certainly. First and foremost, thank you very much for having us here this morning. For the call that we received on Friday was one of comfort, genuinity of support and concern. So he expressed the gratitude for the leadership that our board has taken on this and for the support of district leadership in supporting that decision and doing what we believe is in the best interest for our students here locally in Broward County.
Dr. Osgood, that letter also came with an offer of support, federal dollars to supplant whatever the state might use as a consequence, taking back some financial support from the state. It's gotten to be a real back and forth this week, and ugly at times and quite diplomatic at times, as was your response to the Department of Education, Florida Department of Education, when you essentially said, here's our response to your investigation. We're holding the line. We're going to do masking. Here's our case. Tell our viewers in a couple of lines, restate that case and your reasons for deciding not to comply.
Well, we believe that the lives of our students and staff are invaluable. We also believe that there is a local parentis rights in which teachers are responsible for the health and safety of children when they are in their custody in school and in their preview. And we're just not willing to risk the lives of our students. 8 out of 9 of us voted to mandate masks. We are holding fast. We will not put our students and our staff in jeopardy. We will listen at the outpour of our community who wants us to mandate masks, and we will do everything that we can to put the lives of our students and staff, the people that we love, first.
And you, in that letter, actually told the department you are in compliance because there is an opt-out clause in the mandate with medical consent or medical proof. Why not make an opt-out, much like Monroe County did, so many of the other Florida districts? Why not make an opt-out for parents' choice and see what happens to comply with the rules? Why would that be so bad?
We can't put individual parents and personal choice above the risk of lives of all the others that are in the school system. It's just like when I put my 6-year-old granddaughter, Kyla, and my handsome grandson, who is 17 months, Gabe, into a car. I have to put them in a car seat in a seat belt. Me or their parents don't have a right. We have to look at the good of the whole. And the truth is, many people are unvaccinated. We're seeing COVID cases increase daily like never before. The risk and danger of someone dying or being infected in a negative way with COVID and having lifelong complications is greater than ever before. Our positivity rates now are higher than ever before. And we're not going to play Russian roulette with people's lives.
Yeah. Dr. Cartwright, you were formerly the school superintendent in Oshkosh, Wisconsin, a lovely but a smaller community. You've been living in Orlando. I kind of wonder if you might feel like you dropped into another planet. You've come right in the middle of a really heated debate involving the governor, and where your school district is now at odds with the governor and the commissioner of education in the state of Florida. Are you comfortable with your position?
I believe that given the statistics that are here within Broward County right now, that our board has definitely made a decision with full knowledge of what those statistics are. Frankly speaking, as of Friday, when we're looking at our hospitalization rates here in Broward County for our ICU pediatric unit, as of Friday, they're at 100% bed capacity. Now, not all of those students or children are in there because of COVID reasons. However, it does limit the ability for our hospitals to be able to provide the appropriate services for our students who may need those services. So that is very alarming. When we sent the letter off, it wasn't at 100%. And then here Friday, we get confirmation. Now we're at 100% for our students. Coming from Wisconsin, I was superintendent up there for 3 years. The school districts up there are very different as how they're organized than as here in Florida. And so there was over 420 school districts up there, but I was in the 11th largest one in Wisconsin. And even up there, we've been dealing with Wisconsin, COVID related events and such. And a lot of this controversy, as you might say, for the past year and a half, going all the way from, do you have school virtual? Do you have it hybrid? Do you have it in person? Do you wear masks? Do you not wear masks? So this is not new for me as to these type of conversations that are going on. And previous to that, you're absolutely right. I was in Orlando. I was in Orange County Public Schools for 17 years. So I'm very comfortable with very large urban districts and the interactions that happen with our local legislators, as well as our governor, the State Board of Education. And those are experiences that I'm leaning upon right now.
I want to pick up on a statistic you just gave, the ICU, pediatric ICU beds. We actually are going to have CMO, Chief Medical Officer for Aventura Hospital later in this program. We're going to talk about that. Dr. Osgood, one of the governor's arguments is that the pediatric cases, while really blossoming with the whole of this surge, have percentage-wise have remained the same. In other words, there are no more increase in pediatric cases, but the increase is the same percentage, under 2%, as it's been from the very beginning of the pandemic. So that's one of his arguments. And the other is that there is really no study about the disadvantages there may be for masking in classroom learning environments, specifically for the younger children learning phonics or learning to speak. Is that a valid argument? Is there a potential downside for learning with masks on all the time?
Well, what we know is that there are options to face coverings where parents can use face shields. We saw when we had virtual learning with the students that academics failed drastically. We know that our students need to be back in person, face to face with their teachers, their peers, in a loving classroom environment. We know with class size being 26 and having potentially one teacher and one ESP or two teachers, 27 or 28 people in a closed space, we cannot practice 6 feet and 3 feet of social distancing. So we have to mitigate the risk of people's lives. If we keep our children alive and protected from COVID, then we can teach them. We can continue to work to make sure that they have learning gains. That argument is not a good argument. The American Association of Pediatrics have clearly said to us what the recommendation is about students wearing masks, particularly those under 12 that cannot be vaccinated. We've heard from countless medical professionals all across this nation. We've heard from Dr. Fauci and others. I, Glenna, will not ignore the science. I believe that in this space, in this time of a pandemic, those in the medical profession are the experts, and we have to listen to their expertise and their experience. And to lose one kid, when you say under 1%, 2%, that's too many. For one child to die, one person to die because we chose not to make mask mandated is unacceptable. And we're just not going to do it. We value lives first.
Yeah, if I can, and we have about 20 seconds left in this segment, but Dr. Osgood, why shouldn't all the teachers in Broward County be vaccinated as a requirement? I mean, shouldn't they all be vaccinated when they're in the classroom with kids?
We would like for them to, but we don't believe as a local school board legally we have that authority. We are looking into that So we don't have the authority under our purview to mandate all teachers to be vaccinated, but we have decided to give a $250 incentive to all employees that are vaccinated as our way of doing what we can right now to encourage vaccinations.
Dr. Osgood, Dr. Cartwright, sit tight. We're going to take a quick break and we will continue our conversation when we come right back.
Welcome back. We are talking with Rosalind Osgood, the chair of the Broward County School Board, and Dr. Vicki Cartwright, the new interim superintendent. Dr. Cartwright, let me ask you if there is a lesson to be learned for your school district, and indeed all school districts in the state, from what has gone on this week in Palm Beach County. I know you've been following this. School there started Tuesday, and by Friday, 1,020 children had been removed from classes, sent home, told to quarantine. 134 students, 26 staff members, or 108 students, 26 staff members had tested positive, and it seems that is the result of the fact that about 8,000 parents and students opted not to wear masks. All they needed to do that was just a note from a parent, not a note from a doctor. What is there to be learned there for Broward County Public Schools?
I think first and foremost, I think the very first lesson is that our board had made the right decision. And again, I'm right there supporting them and making sure that we are aligned and ready to go on our first day of school, Wednesday, with that mandate in place. The other thing that I think is also important to recognize is that it's going to be very important for us to have flexibility and understand that, and asking for our parents and for our staff members in our community have grace as well. You know, we're not out of the woods on this just yet. There's a lot more coming, we know that, but every safety protocol that we can put into place in order to ensure the safety of our students, our staff members in our community, we're going to do.
Yeah, a little follow-up, if I may. Bottom line, it seems to be that you are saying, the board is saying, that a child is not going to go to a Broward County classroom wearing a mask and have to sit next to a child unvaccinated who is not wearing a mask. I mean, you're not going to have maskless kids and masked kids in the same class at all.
Well, the only exception to that rule are going to be where it is something that is allowable as an accommodation under a student's 504 plan or individualized education plan or possibly a health plan. So those are the only exemptions that are in place there. But even then, we're looking to what are some other provisions that we can put into place related to that masking in order to help control potential spread. So I think that's important. The other thing I think is also important is we're still examining right now what our guidelines are going to be as to quarantining. There is a difference between those students or those individuals who are vaccinated, those who are not vaccinated, those who are wearing face coverings, and those who are not wearing face coverings. The most recent CDC guidance that came out about students who are masked, vaccinated too, not having to quarantine if they are not symptomatic is a win-win to the mask and reduce the number of quarantines. But again, we're under review of those guidance that's been provided by the CDC and by the state Department of Health.
You know, the Florida Department of Education, when those rules came out, we're all focusing on this mask mandate, but there are 3 rules that came out last week. Dr. Osgood, one of them was about providing appropriate instruction for those who opt out who are not in classrooms. And because we are a live real-time show, we have a viewer who actually just emailed us and asked about the possibility of virtual school, because that's actually a state mandate as well. Can you talk a little bit about, are there other components that Broward will be defying, and is that one of them? How do opt-out students learn?
Well, we're not interpreting it in that way. The governor's executive order for virtual learning or synchronous learning ended. And synchronous learning would be something that we would have to collectively bargain with our union groups. We are looking for, as Dr. Cartwright said, other means of those students that are quarantined, that they're able to still receive instructions. We use a platform that's called Canvas that allows a parent or student to have access to education 24 hours a day, even when we're not in COVID. I think also it's important to mention the whole part of those rules that talk about this new term that the governor and the Commissioner of Education created about this COVID harassment, that parents who choose to have their students not wear masks, if we put them in a secluded area or we separate them from other students, that they can receive a scholarship to go to a private school because now they are suffering COVID harassment. You know, it is just another attempt to take resources from a public school, which is necessary for some students. I represent a predominantly African-American community. The parents can't afford to take their kids out and put them into a private school and pay $20,000, $30,000 of tuition. So you have a public school system that is a necessity to a majority of our students because we are a minority majority county. And when you continue to take resources away from that school system, it really hurts our kids. So I'm hoping that the governor and the Commissioner of Education will just really search their souls and listen at the people of Broward County and work with us to create safe learning environments with adequate resources for all of our students so that they can succeed academically, achieve academically, and be prepared for their future.
Yeah, if I could, Dr. Osgood, just a little fact check here. I believe the amount of money that the state would give to the Hope Scholarship kids is around $5,800. The state of Florida is not going to pay $20,000 tuition to Pinecrest or Gulliver or to a very fine private school. That just is not in the cards. They don't do that.
That's not what I said, Michael. What I said was with the Hope Scholarship, that's not the full tuition. Private schools
Right.
tuition starts from around $20,000 and some are higher. So with that scholarship, the average student, 60% of our students are free and reduced lunch students. So with that scholarship, many parents cannot afford to make up the difference to fund the private school tuition. It provides them to not have that opportunity.
Yeah, point taken. We got it. All right, Dr. Rosalind Osgood, Dr. Vicki Cartwright, great to speak with you this morning. Good luck when classes begin Wednesday, is it not, when your classes resume?
Correct.
Wednesday is the first day of school.
Okay, well, have a great first day. Have a great year.
Thank you.
And before we go, may I just give condolences on all our behalfs to you and the families of the 3 educators who lost their battle with COVID. We are so sorry to hear that.
Thank you.
Thank you, Glenda.